Good morning, Western Balkans. Good morning, everyone. Good morning, and welcome to the second day of our conference organized within the framework of the project RYDE. And I'm really very happy that we can discuss today, to be together and to explore the possibilities and the needs and the ways how youth and young people in the Western Balkans can be really a part of, not only a part, but really a driving force for change, for reforms, for EU integration, for everything that matters. And that's why I'm really very happy to open the second day of our conference. Yesterday we had a very long day, but also a very inspiring, very fruitful discussions on really very important topics such as youth and employment and also participation of youth in the reform processes. But today we have three more panels which also tackle a very crucial and very important topics. The one which we are going to start with the second day is on youth well-being in focus, health, housing and culture. Skopje Studio is actually is hosting this panel, and I'm really very happy to announce it today because the moderator will be Anna Zafirova, a communication expert. Also, we have the facilitator Biljana Dukovska. She is now not only to speak, but also to hear, watch, and to summarize everything that we are going to discuss. And she has also a very important task to, together with all of us, but to summarize the recommendations that will come up from the fruitful discussion that we are expecting. Also, I'm very glad to say that yesterday, but also today, we have the Ministry of Social Policy, Demography and Youth participating. Today with us is Lejla Mehmedi. Also, we have Dragana Karovska from HERA. We have Nadica Skeparoska, Master of Science in Clinical Psychology. And we have, but I'm not taking the floor to Anna. Anna will also introduce the other panelists which are coming from Kosovo. Reze Duli, also Katarina Vučković from Bosnia and Herzegovina. Then we have Vukašin Grozdanović from Opens Serbia, and Doralda Tanelaris, sociologist and project coordinator in Albania. Also, we have some more presentation and discussion, but I don't want to keep your time more than, because I believe that you are all eager to start with the discussion. Just for me to announce that the topics of two other panels is going to be on youth and digital landscape and also on youth and nature. So let's the game start. Let's the discussion start. And I am also expecting, and we are also expecting to have a vibrant, inspiring discussions. Thank you.
Thank you, Janet, for introduction and to great panel. Good morning from the Balkan Studio. It's a pleasure to be always here, especially with the audience. I hope.
Excuse me, sorry, your microphone is off. Excuse me, Skopje, we can't hear you. Your microphone is off, or something's happening with the audio.
Let's check it out.
No, we can hear you. Yeah.
Okay. Thanks. Okay, welcome in Skopje Studio. I hope that you will enjoy our discussion. We are at the beginning of the third panel. And as Biljana said previously, we will discuss, it will be focused on health, housing, and culture. And just for an introduction, it was a journey to be a part and to contribute to such a project, Regional Youth Dialogue for Europe, with our partners. We were eager to share our knowledge, skills, know-how, with the same aim, strengthening the participatory democracy of European integration and the regional influence of civil society organization, especially youth organization, the promotion of democratic values, political, economic, and social benefits for European integration of the Western Balkans. In our panel, we will try to see how our region is facing challenges with mental and sexual reproductive health, and how does it in European Union, how far or how close we are from green transition and building smart cities, and do we have affordable housing for young people in the region. And then we will try to answer the question how European programs like Creative Europe and Erasmus Plus contribute to greater understanding and cultural cooperation among young people from our region. And as Biljana mentioned, with our panelists, we will discuss on these topics, but at the beginning, I would like to introduce Biljana Dukovska. She will be the facilitator of this discussion, and I'm giving you a floor just to make a frame for our discussion.
Thank you, Anna. It's very easy when you have Anna as a moderator and such an experience, you can inspire guest speakers in the first panel, and especially happy that well-being is my topic. I'm actual president of Macedonian anti-poverty platform, which targets most of the things which are related with well-being. I don't know if everybody knows what well-being means and how it is related with the youth. It is something that provides comfort, happiness, and health to all of the young people. Meaning that what we are discussing now about health, culture, and housing is totally at the same page. So I don't want to go deep in the topics because we have our experts. My role here is to open the discussion, to think you about possible questions in the second part of the panel, and maybe to inspire our speakers to put something from what I'm mentioning. I'm sure that I'm online with Dragana, which is our first panelist, because we have a small chit-chat for this panel. And that was my first remark. As a facilitator, I would like to have a discussion, follow the discussion, in which we have 2 segments. In first one, speaking about necessity of having a framework, a national policy, a national strategy, some document which can be actually putting barriers of a minimum standards which are important for youth in culture, in health, in housing, whatever, but not stick to it as we have a document, but because document is nothing if it doesn't belong to ones who is made for. So the first side is to have a good document, good framework, good legislative, in which participation and democracy were implemented during making of that document. But the second thing is take action, make activities, realize projects, whatever you have possibilities to do in your communities, so to overcome the biggest necessities of the youth. So not always depend from the national policy, but create your local policies, local documents, or just make an examples for good case studies which can provide or open a way to a better future of the youth. That's the first thing I would like to say. And the second thing, which is very important, and I find out that it's already been taken into consideration during the first part of the project, during the policy labs, that is how we make things work in multi-layer approach, involving different policies, different stakeholders, and different levels of development and prosecution of things. So I would like to a point that it's not the best practice if we generalize what we are speaking about. For example, speaking about youth, having opportunity to be engaged in processes is not enough if we didn't develop mechanisms how they can be attracted and how actually they can meaningfully participate into the work. That's the first thing. And the second thing, who are the young people? Are ones which are closer to us, the ones recognized only by age? Are those people from the homeless families and the social beneficiaries, or they are just the ones who have biggest connections in this Balkan setting? Are those young people who already have some political, economic influence and status in society, or we are speaking of a different categories and groups with specific interests and specific marks in the society? So it's very important to create policies which are for everybody, not meaning that one size fits all, but specify phases for I don't know, documents, activities, mechanism for each group. I saw in the previous work that a lot of was done about the culture, and a lot was told about the health. But what is the newest trend, speaking with youth and related with European agenda, is affordable housing, which I don't know if it was raised in previous discussion, previous development of the recommendations and conclusions done by youth groups involved in the countries which were part of different activities in the past 2 years. But I'm sure that they're sharing the same status, meaning there is not enough affordable housing for the young people in our region. Now it's the period in which the Europe is very dedicated for developing the first one for affordable housing. We are in a period where the first European anti-poverty strategy is developing, which includes housing as one of the essential services which everybody should have, including young people. But when we speak about youth, we see somebody which lives together with their parents, in our case, more or long than average European citizen, which means that our youth, when I mean our, I'm speaking about Macedonia and the youth from the region, is facing delayed dependence, meaning that staying in the child room in a family house doesn't provide you a lot of space for your development. That's not the thing I should tell young, but we should hear them how actually that devastating their mental health, their privacy, their possibility to go and arrange something else. So we need to discuss more in relation with social exclusion, anti-poverty, and inequality sequence, meaning that speaking about well-being, we need to speak more about policies which are for groups which are usually not seen and not represented in the mainstream talks. I would like to emphasize that housing is something that it's very close to the local governance, but most of the time expectancy is national governments to invest in them. We see housing as social housing, as student housing most of the time, and we forget that we have youth categories before and after studies. So it's not very easy to speak in general about housing, because we need to hear what are the differences from the pupils which are in the secondary school, coming from the rural areas to the big city to do something which is not available in their surrounding. And then we need to speak about young people which finish their schooling and they're under the pressure to find their first dignified work or to invest more in their future or to develop new skills.
something which is not usually related with housing, but it's really tightly dependent one of another. I saw the signals that I've gone through my 10 minutes. Luckily, that was my last sentence. My point is that those words are not the preach. Those words are something that I would like to hear and to find a solution during today's panels. And I will be very happy if at the end I have my points into the recommendations. Thank you.
Thank you, Biljana, for a vivid intro to our panel. I hope that the other studios from our conference were able to hear you, and we'll continue with those type of the microphones. At the beginning of our panel, Biljana was facing the topics of our discussion, and she did some kind of a grounding of our panel, and it is a proper time to introduce our first panelist. She is coming from a Ministry of Social Policy, Demography and Youth in North Macedonia. Her name is Lejla Mehmedi, and let's see what our local government did about youth on this topic.
Hello, everyone. I suppose you can hear me? Okay. Distinguished representatives, esteemed colleagues, and ladies and gentlemen, it is my honor to address this panel on behalf of the Ministry of Social Policy, Demography and Youth. This discussion carries particular meaning for me personally, as a young person myself, because I understand firsthand how important it is for our voices to be heard and to be taken seriously. I would like to express our appreciation for this conference, which recognizes the importance of amplifying youth voices across the Western Balkans and acknowledges the shared challenges and opportunities that shape our region. And when we speak about youth well-being in North Macedonia, especially in the areas of health, housing, and culture, we speak within a regional landscape marked by economic uncertainty, demographic pressures, and disparities in access to opportunities. Yet, we also speak about a generation that is now more informed, more resilient, and more engaged than ever before. Over the past several years, North Macedonia has built a solid institutional and legal foundation for youth policy. The law on youth participation and youth policies, held in 2020, marked a turning point, establishing mechanisms in youth organizational structures in national level. Through these structures, young people are recognized not just as beneficiaries, but as partners in policy making. As well as the National Youth Strategy in 2023-2027, developed through broad consultations, provides the framework across 8 key areas, which are participation, information, youth work, education, culture, health, entrepreneurship, and security. This strategic direction was strengthened by the establishment of the Ministry of Social Policy, Demography and Youth in 2024, which elevated youth affairs to the ministerial level and improved cross-sectoral coordination. By integrating youth policy with social protection and demographic development, the ministry can respond more directly to the everyday challenges young people face, particularly in housing, economic insecurity, and access to opportunities. Recent efforts to improve student accommodation, create clearer pathways to social housing, and support vulnerable youth reflects our commitment to stability, fairness, and equal access. It is also important to emphasize that youth policies and their implementation involve a wide range of institutions at both the central and local levels. As the youth sector within the ministry, we primarily act as the creators of youth policies with many institutions across the Republic of North Macedonia, which are responsible for implementing these policies. The ministry is increasingly prioritizing a holistic approach to youth health by expanding mental health support, improving access to trustworthy information, and strengthening education around healthy lifestyles, sexual and reproductive health, and prevention. Although systemic challenges persist, the ministry's ongoing initiatives and reforms reflect a clear commitment to building more accessible, modern, and youth-friendly health services across the country. When addressing culture, we understand that it is not an accessory to youth well-being, but it is Excuse me. It is a crucial element that shapes identity, strengthens belonging, and opens space for creativity, expression, and dialogue. Supporting cultural participation means supporting mental health, community cohesion, and the development of confident and active citizens. For us, investing in culture means investing in the inner life of society. But beyond all the structures, strategies, and reforms, what truly matters and what this conference rightly highlights is trust. Trust between institutions and young people, trust that voices genuinely shapes policy, trust that the young people's boldness, creativity, and initiative are not only welcome, but needed. Because youth well-being is not merely about the services we provide, it is about empowerment. Young people across the Western Balkans are innovative, solution-driven, and courageous. They bring ideas that transcend borders and political cycles. Our responsibility as institution is to open doors, to create space for experimentation, for participation, and for cultural and civic expression at every level, local, national, and regional. I also want to emphasize the importance of regional cooperation, where the young people of our region share similar struggles, but also similar dreams. Platforms like this conference allow us to develop better policies based on real needs, lived experiences, and shared aspirations. As ministry, we remain committed to building policies with young people and not just for them, and this in North Macedonia and Western Balkans. Thank you very much.
Thank you very much, Ms. Mehmedi, for those words of hope for young people. I hope that our government will stay on that path. But according to the NGO sector, civil organization, how does the picture look like? We'll hear from Dragana Karovska. She's coming from HERA-Health Education and Research Association in North Macedonia. And Dragana, I would like to leave the floor for you.
Thank you, Anna. Good morning, everybody. Firstly, I would like to thank you for the invitation and to congratulate you for the great project that you're implementing and for using this creative format of organizing this regional conference and having I think five countries and 5 cities together discussing these important topics. As Anna said, I'm coming from HERA, NGO, active already more than 25 years. It was mainly in the field of health, sexual and reproductive health and rights, but also we are working a lot, especially through the youth program that I'm leading for almost 5 or 6 years. I don't know how much already. We are working on different topics, not only health, but health is our priority, of course, because if we want our youth here, if we want to use all of the potential of our young people, we need them healthy. We need to take care of their sexual reproductive health, but also their mental health. So it's great that we are talking also on a regional level because our program is also regionally oriented. Actually, this year started with a huge regional conference in our program as well, where 200 young people gathered together to discuss all of these topics. And when it comes to health, the conclusion was that there are huge barriers that they are facing regarding services in our country, regarding information and proper education, available education that are available for them in order for them to bring informed decisions about their security, about their health, to make healthy decisions in their lives. So even if our schools are equipped with staff, like they have psychologists, they're mainly dealing with everyday issues. They are dealing with conflicts, with behavioral situations, also school anxiety. But when it comes to long-term treatment of young people, if there is any mental health concern which is chronic, or it's more complex, there is no continuity in providing services in mental health. which are based in the schools or based in the community where the young people are living. So that was the main thing that was also emphasized at our regional conference, that they don't have available services for mental health. When we see the research, mainly we are using the data from HBSC, which is very important survey here and globally. We can see that there is still high prevalence of anxiety, depression, violence, psychosomatic symptoms. Maybe my colleague here, she will talk more about the concrete numbers, but all the time, every analysis is just confirming the situation, which is very worrying to us. Something is wrong. They don't know how to take care of their mental health. They don't know where to seek for support. The support is not here. It's not systematic. We are only talking about providing support, but we don't have it. Also, youth aged from 15 to 18 are the most exposed to violence compared to other age groups, which is exactly the age where we meet students in schools. Like, we have institutions where we have those young people every day with adults taking care of them. So we can provide that service, which should be systematically given and given in continuity, not only one time counseling or just I don't know, where there is a fire, then we come to help. We need prevention. Also, we need to talk. We need to destigmatize use of mental health services also, because there is huge stigma around using this kind of services, especially among boys and men in this region. And also when it comes to sexual and reproductive health and rights, numbers are also pretty much worrying. I will use only 2 or 3 numbers just to raise the question about sexual and reproductive health of our youth. It's alarming, really. The adolescent births in 1,000 girls is 14.6, which is almost twice the EU average. There is very low contraception use. It's only 21%. Well, the Balkan average is 52. And in some EU countries, this rate is above 70. Imagine the difference between the numbers. Should I stop talking?
We have just an open mic in some of the studios.
Okay.
Okay.
Again, when it comes to sexual and reproductive health, we need access to services, to youth-friendly services. Not like someone will say, yes, we have clinics and yes, we have, but no, those services should be community-based and they should be youth-friendly. So we are, our recommendation, it's a very good model, is model of I want to know centers, youth-friendly centers, which are at the moment managed by HERA, by the organization where I work. Because we are talking about integrated services, where young person services in sexual and reproductive health when it comes to exams for STIs, providing free of charge contraception, counseling, mental health services. Also, we are providing in our centers free spaces, but later we will talk about that because we are working also in the field of culture a lot. We are using culture to recruit and to activate young people. They need free spaces for making culture, for being creative, for telling us their needs in a creative way. Not every young person can have a speech or be active in formal bodies of youth representation. They need different formats of spreading their voice. So these kind of youth centers, like I Want to Know, are great model. Also, when it comes to youth representation and youth participation, we already have law for youth participation, but it's not being implemented as which is very common in our country. I think that it's in the region as well. Like we have very good legislation on different topics, but we lack implementation. For example, the law in the law, it is predicted that we need to have youth centers in every municipality. So if every municipality at least one youth center, which have integrated services like I mentioned, like this I Want to Know services, then we will have places for young people to have proper access to this kind of services and space for cultural creation. Also, those municipalities, they should have, okay.
We continue? Yeah.
Okay, sorry. So when it comes to youth participation, the law also predicts to have local youth councils, but also national youth council, which is not established still. We have the law for several years already, but we don't have those councils on a local level, which should be a place where young people have meaningful participation, not only to call them to be part of the working groups when we are working on a strategic documents, because we are talking about drafted documents where we are asking them, what do you think about this? No, they should co-create those strategies, those policies. They should propose measures. They should be involved in implementation. They should be involved in monitoring if there is a budget for those measures implementation, to monitor the spending of that budget, etc., etc. So we are speaking about meaningful participation. And also, another thing that I want to emphasize, that we cannot forget for marginalized groups of youth. Like we are not only talking about areas like Skopje. We have something in Skopje, but ask young people from small rural areas if they have services, if someone opinion regarding laws or bylaws or any strategic document or programs or whatever. So we need to take care of marginalized youth like Roma youth, LGBTI youth, or youth with disabilities. They don't have access to services or to education or information. Also, I forgot to mention regarding education. We have very good reform in our education. Ground education is already developed and approved for. It is not an elective subject in 9th grade, but it has been piloted already developed. So the comprehensive program, so we will have youth which is much more safe. They will take care of themselves, of the people around them. There will be democratic values among them, like solidarity and so on. So we recommend development of a program for secondary also education, where it has to be implemented on a next level, like after primary school. So this should be, if you have questions, I can elaborate more on these topics, but this is the situation at the moment. And also all of these things, because the regional conference that I mentioned earlier, it was also by a project co-funded by European Union and Western Balkans Fund. For Balkan countries were in this project, and we have adopted joint declaration on youth empowerment. 200 participants at the regional conference signed this declaration, and everything that I said is in here. So we have the recommendation. It's the same that we are repeating and repeating over and over, but we are not doing anything substantial. So we need to take the steps, concrete steps, to involve young people, to provide youth-friendly services, to have, especially in the health sector, we have preventive programs, but we don't have youth preventive program, and it is huge target group which needs a targeted approach. It's not the same when it comes to the people in one country in general and young people as a specific target group. So we need youth preventive program in health and youth councils and youth centers and everything that I said previously. So I will stop here. If you have questions, I will be happy to answer. Thank you.
Thank you, Dragana, for the input that you did. As Biljana mentioned previously, we have a lot of documents towards young people, but without the life in it. And I think that this conference could be a starting point for give them a life and to be targeted towards the young people, not to do like before hop on and hop off with all the programs that are focused towards young people. As Dragana tackled the topic of mental health, it is very important, especially having in mind that from the COVID period, we have declining line of the mental health, not only of young people, speaking about the general public, but we are here to talk about young people. And with us is Nadica Skeparoska. She is Master of Science in Clinical Psychology. She's certified psychotherapist in transactional analysis in our country. And Nadica, I would like to welcome you and to hear you the intro about this topic.
Thank you, Anna. And thank you for this invitation. I'm glad that I'm here today. And today I speak as a person who sees young people every day in practice. From a private practice, I work in a private practice in Skopje, and I have experience working with young people and children as well as adults. As you mentioned, Anna, last 5 years after the COVID pandemic, we see a lot of young people asking for our services for mental health helping. I see often, very often, young people, they are facing depression and anxiety at most, but also identity crisis as well. And I can say in the private practice, we are overbooked, me and my colleagues. And I can say that in Skopje mainly, the stigma is overcome. So we have a lot of people coming for asking for help. But it's not the situation in the small cities and villages in Macedonia. So we have young people in Skopje. They're not feared to come to ask for help. What we see every day, we see people, young people facing challenges with academic pressure, I see a lot of young people with stress and burnout because they are preparing themselves to go abroad, to study abroad, not stay in our country. So it's a lot of pressure, and they are also facing stress and burnout as we adults do. I see a lot of young people that are facing anxiety because we live in uncertainty every day. They don't have a structure, they don't have a system that is functioning. As Dragana mentioned, we have all in paper, but in practice it's not functioning. I see a lot of young people coming also from poverty, from social economic background that is not very, very developed. We also do a volunteering work with those young people, but it's not sufficient. I see a lot of young people asking for a therapy, but the private therapy is very expensive for them, as well as for the working adults. And they ask for help on every level they can get. I see young people that are struggling with housing. Like I said, they still live with their parents even at 30 years old, and they have identity crisis. Who am I? Am I a child? Am I adult? Am I grown up? So we faced these kind of problems as well, and overcrowded student facilities, and people not having chance to study or waiting to fulfill their dream because of the housing problem. Also, I will say, add to Dragana speaking. I'm confirming everything she said already. We are in the lack of mental health services for young people as well. We have one psychiatry clinic in Skopje. We have one center for mental health for young and children, and we don't have a lot of institutions. We don't have trained psychiatrists to work with young people. We don't have a lot of trained psychologists to work with young people. I come from a privilege that I have studied abroad, but here we lack that kind of experience and education. We are facing with not having space for the young people. They're searching for themselves. They're learning, they're studying, they're consulting ChatGPT, they're learning on forums where to get help, but they don't have help that is accessible to them. I admire those young people. They're asking themselves for the help, but it's not, they're not guided. Also, we have parents in our country that are still stigmatized, and they don't have enough emotional literacy, so they cannot help their children. I do have a lot of parents coming and coming with their children for asking for help, but I see the stigma in them as well. Like we came here, but we don't know if we are in the right place. So I think we have a lot of necessity, but small capacity. Even for private practice, we are overbooked. We cannot, we don't have a capacity anymore. What I see as well, I see a lot of young people coming from domestic violence. We have a little bit of shelters for them, housing problem again. I see a lot of young people coming from a family where migration is very, very, we see a lot of migration. Their parents live abroad, work abroad. They live by themselves. They have to parent themselves as well. In the small areas of Macedonia, we see a lot of young children living alone or with the grandparents, and it's also very important for their mental health, about their self-esteem, identity, and all well-being. What I see as well, I see young people that are under pressure, a lot of pressure, every day. Coming from school, after school activities, college, college activities, pressure to to succeed, to go abroad, to have grades, to have a full life, to have a social life, and it's not functioning in practice. As well, young people today are facing bullying and social media bullying as well, and bullying in the schools. And what we see in practice, as Dragana mentioned, every school has a psychologist, but it is one psychologist. In the school where my children are going, there is one psychologist and there are 950 children.
It's a huge number.
We can imagine what's happening there. And as Dragana said, they're only facing with behavioral problems, not with anxiety and depression. They're sending the children to private practice as well because they don't have a capacity. We don't have a social worker in the school. We have only one psychologist and one pedagogist, yes.
Or special educator.
A special educator, yes. So my opinion is that we have young people that are well aware they need help and they need something to move on, to face the challenges in a good way, but we are in a lack of capacities. As I said 2 times now, we are overcrowded. And my colleagues psychiatrists will say this as well. We are overcrowded, overbooked, and I'm happy for the young people that are well aware, but we need more services, as Dragana said. I'm glad that HERA do something on this topic. I was part of the first family center that faced domestic violence. We need more of these community services for young people when they can go, listen, contact with each other, share their experience, and share their experience about the therapy as well. Group therapists in those community centers, we need a lot of this in general. That's my opinion. Even if I come from private practice, I think that we need more centers and more services.
According to your speech, I can notice that young people are screaming for help in one hand, but the capacity of the country, of the services are limited, and there is no option for them except maybe solidarity, empathy among them. But we'll see how the things will go in the future, especially with this type of conferences and with the our eager to find an answer for all these challenges that we have right now. Thank you very much, Nadica. I would like to invite the Kosovo studio, the studio in Pristina, to participate in our panel. And I would like to hear from them. Is there are those community service centers option for the youngsters in Kosovo? I would like to invite Mr. Reže Duli. Can we see him? No? Or maybe we can invite Katarina Vučković. She is an expert in youth work and leadership from Bosnia and Herzegovina.
Hello.
Hello.
I'm from Pristina, Reže Duli.
Okay. I would like to welcome you in our panel.
Thank you.
Please, the floor is yours.
Okay, thank you. So we had a discussion from all panelists about youth in each country, and when we talk about Kosovo, we can see that we have very vibrant young society with a very high migration. So the statistics in Kosovo are very weak because of the everyday migration, and especially after the visa liberalization in Kosovo, which happened last year. So generally speaking, Kosovo is influenced by ongoing social challenges, economic limitation, and cultural dynamics. As I said, Kosovo is the youngest has the youngest population in the country. Future depends on how effectively we'll support the youngest people across the key areas like health, housing, and culture. When we talk about health, we don't have a very strong medical health system. However, the health, generally speaking, we have very healthy young people, young society, and although the challenges remain due to limited healthcare institutions, especially in rural areas. Mental health issues such as anxiety and depression are increasing by high number of unemployment, economic pressures, and social stress. However, the lifestyle of young people generally is changing for good. So we can say that the young people are dealing with fitness, outdoor sports, and lifestyle in health. Yes, in consuming healthy products. So these sports facilities are increasing. Fitness centers are increasing in every municipality of Kosovo, which is a good sign that young people are changing their lifestyle, considering that our generation were not dealing with sports and other activities. In Kosovo, if we talk about housing, it is very different from the region, I think, because we have around 82% of Kosovars have their own housing. Around 581,000 people have built apartments or own apartments, and from this number, 200,000 apartments are empty, which means that most of families think about younger generation and they bought apartments. So when these children grow up, to have their own apartments. This is good in statistics. So good sign that people are changing the lifestyle and that the people don't want to live in the extended families. So it sounds very optimistic, and let's see in the coming years how with these facts will change the lifestyle of young people. If we talk about culture, Kosovo is also have in Pristina and other municipality are having many cultural activities, which means that we have very active young people in culture, film, and arts. We have a very famous festival called Dokufest. In Peja we have Anibar. In Mitrovica we have Green Festival and also Rock School. So most of municipalities, through their Directorate of Culture, Youth and Centers, also individual cases, we have that they invest in culture. Maybe the budget is limited, but we can say that most of these festivals and activities became worldwide famous, which means that young people are very interested in cultural activities. Of course, in some municipalities, smaller municipalities, we have many young people who are migrating, which means that many schools will be closed or are closed in last years. So generally speaking, and maybe I'm a bit optimistic as a person, we can say that Kosovo is changing for good for many young people. The bad side is migration. However, the government, or this government of future government, promised that they will invest in the young people, apartments for young people. It's a program which draft law was adopted in 2024, and we hope that around 4,000 apartments will be built for young people and young couples. So this is a promise, which means that the draft law has been passed, And we think that if this will be fulfilled, there are negative sides because the criteria, how they will be developed. However, there is a sign that governments are thinking about young people, so to limit the migration. So this is all for now. If you have any question, I will answer. Thank you.
Thank you for your participation in our panel. Kosovo brings a hope in our panel, the youngest country. I hope that it will come a reality very soon. I would like to invite Katarina Vučković, expert in youth work and leadership from Bosnia and Herzegovina. I'm curious to see, is there that kind of a hope like in Kosovo, in Bosnia and Herzegovina? Katarina, can you hear us?
Yes, I can hear you. Thank you, Anna. And thank for the organizers to giving me opportunity to share a bit of my thoughts on the topics based on my 20+ years working with young people across Bosnia and Herzegovina and the region as well. I think listening to previous speakers, I would go a bit wider, but also a bit regional and more specific in some aspects in Bosnia and Herzegovina. For me, well-being as such is not, well-being of young people is not one thing. It's rather a complexity or overlayerness of all these topics that we are talking about. So it's at least mental health in all the aspects that was previously mentioned by the expert on the mental health, including schools, outside of school, peer, social media, these parallel worlds where young people are living now. Housing and employment, I would say, because it has to do, like, young's well-being has to do with where do we live, with whom do we live, but also how we pay for our rents and what is the, how do we contribute to the society through employment. And then when it comes to culture, I think that we tend in the region, especially at least in Bosnia and Herzegovina, we tend to put it into a frame of, you know, like events and festivals. But culture has to do a lot in our region with identity and expression of freedom. And I think that in the last couple of years, we are seeing a lot of that through either festivals, non-formal groups, or even students' protests and the way that we approach to topics around different topics that young people are approaching and expressing their thoughts. But above all, I think that all starts with youth participation and also the possibility to participate, but not only if the system works, but also if I'm taught to participate, or if I'm allowed to participate, or if I know where, how, and when I can participate. And then if all these topics are a bit rather tackled by our systems and countries when it comes to consequences, we forget to invest. That investment in young people and prevention, both in mental health, sexual and reproductive health, and so on, education as such, and the youth work as such, is something that can prevent us of many other aspects. So somebody mentioned youth centers. I don't think it's feasible for any country in the region to have a youth center in every community, but a youth club, yes. So it's a bit different, still a youth center, but more focused on the local context, very micro context. One of the things that we are seeing in researches across the region, but I would now mention numbers from Bosnia and Herzegovina, is that we have a number of young people that want to leave or tend to leave the country. So the last research done by the Institute for Youth Development, CULT, shows that in Bosnia and Herzegovina, 50% of young people want to leave the country. 12% of them already are doing some steps to do that. And 40% of the people in the research said that they have somebody abroad. So they're very aware of the well-being of a person in Vienna or a person in New York or in Berlin, as well as they're very aware of, since we are so interconnected, aware of the well-being of a young person in Kosovo or Serbia or Croatia or Skopje. So in this sense, I think that we need to be aware that we need to tackle these issues very locally, but also have this broader perspective, sorry. These numbers in different researches across the Western Balkan countries are there to alarm us, but also they are very connected with well-being in the terms that these numbers are showing that actually young people are deeply unsecured about their future, about the future of the countries, that there is a lack of social and economic security with young people, that system approaches up to today. And in Bosnia, we also have some documents, not all. I will not go now into details of the complexity of the country administration, but all of these aspects that we are discussing today are tackled either on cantonal or entity level, and very few on the state level in Bosnia and Herzegovina, rather on the coordination level. And we still don't have, as many, somebody mentioned, we still don't have functional state body that will deal with youth issues and youth needs. We do have youth councils in both entities in Brčko district, but this is still not enough in the terms that there are documents that are in place, but they're not planned with a budget. So the documents are being adopted, but there's no money to invest. And the decision makers are not seeing this as a investment, but rather more spending in this current moment. So we need to learn also, our decision makers, that youth participation needs to be part of their processes, and that they need to also think of investment into youth plans or policy papers on the youth issues as an investment for the today and the future, rather than saving current situations and working on that. One thing that nobody still mentioned, and I will go, is also this well-being is connected with transgenerational trauma. And I think we are all over it we will become experts in the region at some point. And this is somehow overlapping also in every aspect of a young person's life. Yeah? So in these terms, it's very, it's something that is happening. Also, our countries are tackled with refugee crisis after Corona and during Corona. So we have some newcomers, and this is also affecting our culture. Many of young people are actually today already parents. So I think that well-being of young parents is something that we also need to think. And when it comes to housing, there's a huge, I don't know if anything changed, but I didn't find it in a couple of days coming here. We have a high value that having your own roof under, like above your head, having your own house is the way to succeed. So having your own property is one way. And most of our housing programs are coming from this point of view, supporting young people with their first purchasing their first property and so on. But nobody's talking about affordable housing for secondary school students coming from smaller area to bigger areas for studying, having more secure and better conditions in working and having shelters and dormitories where students are studying and spending at least 3 or 5 or more years. And this is something that has to do with housing as well. According to the study that I was mentioning previously, 65% of young people from Bosnia and Herzegovina are still living with their parents. And this is not by their choice. I would say that it's necessity. And it also comes from the geographical and demographical aspects of the country, but also it comes from this cultural belief that you need to, settle down everything and then get married and then start a family and so on. And it has to do with these insecurities, because if you're economically and socially insecure, and if you cannot purchase the house, and the high value in the culture is to have your own house, then you're becoming more insecurity, and then this still affects your other parts of the life. And this is expectation that the colleague on the mental health was speaking. This is another pressure that comes in the wider aspects, is that you need to do certain things in your life in order to be a successful, having a house being one. There are some EU examples how this can be used, how this can be done. In Bosnia, very often we are mentioning Vienna social housing model, but I don't think that it's like truly copy-pastable to our countries. It really needs to reflect local context. Policies on housing should be integrated into youth policies, need to be like rather more broader looking at, but then also very specific. For Bosnia, that's also very specific when it comes to administration of the countries. Each canton can do their own regulations on housing and all their own policies, and many of them do have some of the programs. Not all are very functional. Also, I'm thinking that we are facing and working with a generation of young people who are very aware of the global aspects. So green transition is one thing. So affordable housing should also be in line with a green transition. So it's not only that I can get a good credit from the bank and purchase my own, my first house, but it's also what kind of house is that? Can it be supported with, can it be more green? Smart cities across Europe are thinking about this. They are actually tying youth policies and youth housing programs to the green policies. And this is something that we might learn from the Western Europe. I think that housing programs are the ones, and employment programs are the ones that we need to really focusedly, aggressively look at in the region if we want young people to stay in our countries. Otherwise, we also need to think in these programs, what do we do with new families that are here? We still have number of refugees on the pathway to Western Europe, but still in our countries. So cultural aspects of these, integration of newcomers, respecting others, understanding region is something that we also need to think. These people are not living, and these young people are not living in a very good conditions. This also reflects how average Bosnian and Herzegovinian is looking at their own life, as well as understanding how their peers are living in the Western Europe. Yeah, last but not the least, on the cultural, I think that generally culture is being there's a lot of money that is being invested across the countries, but the quality of the cultural programs are low. And basically there is not enough investment and also not enough space for young people to be part of the decision-making processes in all of these aspects, but especially in the cultural programs. They are not there. I mean, the festivals are mostly, the huge festivals are mostly happening, and the huge events are mostly happening with adults' decisions. Regional programs such as RYDE exchange of schools and the cultural fund are showing that there are different aspects of the regional cultural programs that can support overcoming prejudice, support one's identity development, also expression, cultural expression, and so on. I think that the larger Creative Europe program also shows that we can make culture more accessible to young people, also make it more connected with the decision makers and the local authorities. However, these programs are less connected with rural youth. I don't know if you're trying to give me the sign that I need to finish
because we are passing the time that
okay. Let me just say one last sentence. I think that what young people are asking from us is actually for system to work. And this actually means that they want to be part of co-creation, and that we really need to address investments in the terms of budgeting of all the things that we are talking about. Thank you.
Thank you, Katarina. You mentioned a lot of things that are very important for young people, for well-being of young people, but I took it like a pretty close to me transgeneration trauma that you mentioned in your speech. Having in mind our next speaker, I would like to invite Vukašin Grozdanović from Open Serbia. I think that any of us has an open eyes towards this region in the last period. And I'm pretty much curious about his speech. Please, Vukašin, are you here with us?
Yes, I'm here. Greetings from Belgrade, greetings from Serbia. It's a pleasure having an opportunity to speak with you all. I agree with a lot of topics and comments that were made by previous speakers, so I will not go more into them, but I will maybe go into something that I think we could do in order to change the situation that we all clearly see what are the problems, and we have the type of solutions that could work. I think that we should maybe change the approach in advocating for those programs and activities to be implementing. So I think that the way that we have been advocating for the change in programs and for continuing funding for the programs has not produced the results that have been needed. So we need to change the concept. How do we advocate for youth programs, for youth activities, for youth sustainability? Because the biggest change in when opens and Novi Sad became European Youth Capital, and when we were advocating differently, made a big change, was we were not only advocating from the point of view it's a health problem or a democracy problem. Yes, these are all problems from those aspects. But when we started saying that this is going to be economic input in the city, economic input for the community, and starting advocating for the economy point, then we started to have more attention from decision maker. So those were still the same problems and still the same activities that we proposed, but we proposed them in a different way, in a different manner, and a different topic. And that is the thing that I learned from Exit, from Novi Sad, because they are a cultural festival, they are a youth festival, but they started advocating from the local self-government and the national government from the point of view of economics. And then when we implemented the Novi Sad European Youth Capital Program, we did a cost-benefit study that says for every euro invested, 2.4 euro returned in the economy in the city. And those were not only cultural programs, those were programs around mental health, programs around including young people in decision-making processes, programs around counseling, all of the programs that you mentioned, youth centers, youth clubs, one-stop shop concepts in Novi Sad. So when we started advocating in the sense that the programs that are going to implement it are going to return the investment to the local self-government or the national government into the economy of the city, we were more successful in attracting funds, in attracting sustainable funds, in attracting funds so we can have services, so we can have more services for young people, free services for young people, and have more programs and access for young people. So I think we need to change the way we advocate for all of those programs. And we need to find a way the decision makers think in order to make it more appealed for them to invest in those kinds of programs. And when we did that, it changed the stratosphere. How do we do it here in Novi Sad, in Serbia? In generally, Opens for the past 10 years it has been existed, has been able to attract over 50 million euros to different programs in Novi Sad, and we were able to give over 50% of that money to different organizations to implement the grassroots programs on the local and the national level. So if we change the way we advocate for all of these programs to decision makers, we can attract more funds, we can use the existing funds more efficiently, and we can have more sustainable change on the local level. If we always go from the perspective of health or the perspective of let's include young people in decision-making process, sometimes it's very hard for decision makers to understand and to hear it. And if we talk the language they understand, but still do the same programs and achieve the same results, we can have more efficient funding raising, and that is all we need. More funds to have more services, more programs, and to reach to more young people. We know the answers, what programs are good, what kind of services do we need, what kind of cooperation do we need, but we do not have enough funds and we do not have enough cooperation either between organizations or between organizations and institutions. And if we can change that and really cooperate and really try to advocate for these programs in a different way, we can have more success. And I think that the story from Novi Sad is an example of that, even more so because of, let's say, 2 months ago, Opens Novi Sad won a second prize of the new European Bauhaus Award on the European level. So that concept of regaining sense of belonging, doing something differently but achieving the same result, we need to change the way in our thinking, because if we have been doing this for 25 years and the lack of results is as we see it today, maybe we need to change our approach in the things that we have been doing for the past 25 years. This is what I wanted to maybe try to tie in all of the things that we're hearing. Maybe a different approach from us can lead to better chances and to better improvement for the services for young people.
Vukasin, thank you very much for your energy, for the passion that you have, and for different point of view on this topic. Maybe the key words related with the well-being could be earning money towards the policymakers, and maybe that kind of a word could be alert for all of them, especially on the in the name of the health, housing, and culture of the young people. The next speaker is coming from Tirana studio, Doralda Tenelari, so psychologist and project coordinator. Can you hear? Yeah, please, we're expecting you.
Thank you for giving the opportunity to be here and discuss with you some topics that I think that are more interesting, more problematic, but we have it all the time, and the youth is related to them. I want to speak about the mental health. As a sociologist and as a researcher, I have some recommendation at the end of my word. So I want to be focused and read my work and what I have prepared for today. Youth mental health today is one of the most important issues. According to the World Health Organization, 1 in 5 children and teenagers in Europe lives with a mental health disorder. And suicide is the second leading cause of the death among young people aged 15 to 29 years old. These numbers show that the emotional well-being of the young generation is in a critical state and needs urgent action. At the European level, the EU has introduced a new approach to the mental health with 20 priorities, initiatives, and 1.3 billion euros available for member states. These initiatives focus on prevention, emotional education in schools, reducing stigma, digital safety, and strong community-based services, a model now seen as an international standard. These European challenges are also present in Albania. Young people in Albania face similar pressures, often made worse by economic insecurity, unemployment, lack of young spaces, and strong stigma around seeking psychological help. According to UNICEF Albania, young people are facing mental health problems, and post-pandemic periods shows a clear increase of anxiety, depression, and social isolation. At an institutional level, Albania has approved the National Action Plan for Mental Health 23-26, which provides a comprehensive roadmap to strengthen the country's mental health system. The plan aims to expand community centers, strengthen early services for children and adolescents, modernize regional hospitals, strengthen early services, train multidisciplinary staff, and it also focused on informing vulnerable groups, promoting social reintegration, and offering rehabilitation through community centers and supporting housing for people with mental health conditions. One of the main objectives is to increase the number of mental health professionals with a goal to triple the number of psychologists in the public system and to integrate mental health services with social and healthcare services through a social health approach. This plan also includes support for resilience during emergencies and crises, while ensuring respect for human rights. However, challenges remain. Funding is limited, resources are insufficient, and gaps exist between policy and practical implementation. Additionally, youth-based project Power Youth implementation are improving well-being and supporting youth to upgrade. As a sociologist, I want to emphasize that mental health is not also only a clinical issue, but it is closely connected to how our society functions. The educational system, the academic pressure, the job market, the economic stress, the digital environment, the family and community relationship. All these factors affect the mental well-being of young people, both in EU, in our region, and in Albania. To face these challenges, we need to integrate and continue approaching different recommendations and findings about the implementation of the politics for creating opportunities for young people. I want to give my 5 recommendations that I think that are important not only for youth or teenagers in Albania, but in Europe or everywhere the young people are facing difficulties. First, invest in emotional education in school, skills for stress management, especially in rural area and vulnerable groups. Strengthen community services and offer free psychological support. Third, organize strong anti-stigma campaign. Mental health should not be seen as a weakness, but a normal part of human being. 4, create safe physical and digital spaces where young people can express themselves and ask for help and without fear. And finally, improve young people directly and integrate them in policy making. Policies for youth must be built by youth. Dear participants, youth mental health is an investment for our future. If we want a strong, fair, and sustainable society, we must build support systems that give young people safety, space, and hope. The EU and Albania are moving in the same direction. Now we need more speed, more cooperation, and more action. Thank you for hearing me.
Dorana, thank you very much for your participation in the panel. The next one and the last panelist for today from Skopje studio is Teodora Milevska. She will do a presentation of the project RYDE Lines, coming from informal group RYDE Lines, supported within the RYDE project. Teodora, we are waiting for your presentation. I hope that it will be short because we are running out of time. Teodora, can you? She is coming from the Sarajevo studio, yeah?
Yes, okay. Can you hear me now?
Yeah.
Really showcasing our interconnectedness being from Macedonia, North Macedonia, but joining from the Sarajevo studio. I also want to say that I'm very happy to be the second young person on this panel, showcasing the diversity of young people who are working in the government, as well as out of government to push for some changes. So hi everyone, I'm Teodora Milevska. I am an activist and advocate working on menstrual justice in North Macedonia. I'm also a United Nations Young Leader for the Sustainable Development Goals, being the first ever representative coming from the Western Balkans. And as many of you in the studios across the Western Balkans, I'm sure you have multiple roles and multiple hats that you have throughout your work. For this particular presentation, I'm going to put my hat as a member, as well as team lead of the RYDE Lines non-formal group. I have some good news and some bad news. I've heard all of the panelists, and all of the issues that are raised are very relevant to the young people living across Western Balkans. The bad news is that I'm bringing in another issue, which is the menstrual stigma and menstrual poverty. But the good news is that I'm also bringing some solutions and recommendations on how we can push this issue forward. The informal group RYDE Lines was founded in 2025 by a collective of young activists working in North Macedonia, Albania, and Kosovo. who had previously collaborated on various levels through youth work, feminist initiatives, and creative advocacy. Granted, we have never worked together on menstrual justice. And why we chose this issue. In North Macedonia, the menstrual justice study in 2021 revealed that 60% of students had never received any education about menstruation, while over 53% of them felt unclean during their period. Nearly 30% couldn't afford basic products, and over 40% admitted to hiding their pads when they needed to switch them. This issue and challenge exists in Kosovo as well, where activists have already protested the so-called imposed tampon tax on period products. And in Albania, a 2024 report highlighted that girls often miss school due to stigma and lack of menstrual hygiene resources. So we're united by a shared commitment to social justice and the urgent need to address menstrual stigma and menstrual poverty, inequality in our communities. This project aims to raise awareness about menstrual health and combat menstrual stigma in the Western Balkans, where menstruation remains a taboo subject surrounded by shame, silence, and misinformation. Young people, especially girls and those who menstruate, face social stigma, lack of education, and limited access to menstrual products. So how we go about making this change? Our starting point are the so-called youth dialogues on menstrual justice, which are happening in North Macedonia. Why we chose North Macedonia as a place for these meetings is due to our diversity and also having 2 official languages. So one of this youth dialogue is happening in Macedonian language. The other one will be happening in Tetovo in Albanian language. The first step is to create safe and empowering spaces for young people to openly discuss menstrual stigma, period poverty, and their experiences in schools and communities. And during this 2 days workshop, first we are working with participants to learn what is period poverty and period stigma, and then for them to explore some of the challenges, reflect to creative exercise, and work in groups to develop youth-led recommendations.
Dora, please, can we go towards the recommendation because of the time?
Yeah.
We are running out of time and we could not...
Okay, these are the girls from Kruševo, 28 high school students who are working on developing the following recommendations. The first one is free period products for students in the case of dispensers or pink boxes. Then we have the local funds for free menstrual products. And in the case of North Macedonia, I'm very happy to have someone coming from the ministries. This is actually a commitment made within the action plan for young strategy. So we would really love to have a follow-up on that one. More educational activities about menstrual health, clean and better toilets in schools, strengthening the capacities of primary care physicians and gynecologists about menstrual health, because even in the scope of sexual and reproductive health and rights, the menstrual health is on the margins, and more advocacy of youth organizations on this topic. These are the girls who developed these recommendations, and you can see them more on our social media campaign, which will have a little bit of mix between using formal language, targeting stakeholders, but also using memes and creative content to target fellow peers for them to understand this issue. Thank you so much for your attention.
Thank you very much for your spirit, for the spirit that you bring in our panel. We are at the end of the panel. Biljana, we are waiting for a recommendation that will wrap up all the discussion that we have.
I can't speak that much fast as our previous speaker, but anyway, since I don't have enough time, I will just summarize only one recommendation from each panelist, and I will start from the end. First, we need more funding and more resources supporting system for the services and funding resources for all programs related with youth housing, culture, and health. To think about changing our approach if we want more successful advocating. We need to tackle lack of social if we more success to face with our countries. We definitely need more trained personnel which can work with youth on mental health, and we need to have more free practice for all youth in need, because they're already aware, but there is not enough facilities, services, or trained personnel. We need to have free spaces for cultural expression, youth centers or youth clubs in every municipality. We need systematically given services for, and we need destigmatization of processes. We need to have access to friendly services which are community-based, and definitely, as a highlight of the panel, we need policies not just written, but ones who are implemented and live and live. We need to have policies which are built together with the young and not just for them. Thank you for your attention. Thank you for your studio in information and different points of view towards well-being of young people, and we see and to work on those topics in the future, connected with all the other participants in this project. Thank you very much from Skopje Studio.